Hi everybody, welcome to Dr. Manny's YouTube Learn Shops. In this presentation we'll be reviewing acute abdomen, gastrointestinal bleeding and liver disease and disorders. I'm just going to briefly review the normal abdomen. Now the abdomen is the body space between the thorax and the pelvis. The diaphragm basically is the dividing area, and it forms the upper surface, and the abdomen ends where the pelvis begins. Now the abdomen contains the stomach, the small and large intestines, the pancreas, the liver, the gallbladder, the kidneys and the spleen. It's important to have an idea about how and what you do when you do an abdominal assessment. Now you can look at the 4 quadrants or you can look at the 9 regions. In the 4 quadrants, you've got the right upper, right lower, and left lower quadrants. It's important to have an understanding about what organs lie beneath these 4 quadrants. To get more information, to become more specific, especially when you're assessing abdominal pain, it's good to have an idea about the 9 abdominopelvic regions, which are divided into the right hypochondriac region and the left hypochondriac region. Chondriac, ribs. So this is the region below the ribs. The epigastric region is basically where the stomach sort of sits, the above the stomach region. Then you've got the middle portions, which again is the umbilical region, and then you've got the right lumbar and the left lumbar region. Below that are 3 other areas, the right iliac region, the left iliac region, and the hypogastric region, or the pelvis. And review the images to have an idea what organs are located within the quadrants and the regions. The diagram that you're looking at below is a combination of the quadrants and the regions, and it can be very, very helpful in determining where abdominal pain could be coming from, which provides you with a differential diagnosis. So you can review those, but however, have a look here now, I've just enlarged it. So you've got these areas causing pain, could indicate pain coming from these conditions. Same applies to the opposite side. If you have pain in these quadrants or these regions, it could indicate that you have issues with these organs or these conditions. When you look at acute abdominal pain, it's defined as a chief complaint in most emergency departments. And there can be numerous potential diagnoses that made in relation to where that abdominal pain is coming from. The important thing is you get a history and an accurate, focused physical assessment, which will lead to certain diagnostic procedures. And it's the clinical evaluation and the laboratory investigations and maybe imaging examinations such as abdominal X-ray, CT scan, MRI, which can establish a correct diagnosis and therefore correct interventions. There's an example now of a bowel obstruction where you've got very distended loops of intestine. When you come to acute abdomen, it's essentially defined as a condition of sudden, abrupt onset that's usually associated with pain due to inflammation, perforation, obstruction, death of tissue, infarction, or rupture of abdominal organs in someone who's been previously healthy, and usually it requires emergency interventions. In the diagram that you're looking at in the chest X-ray, you can see that there is air under the right hemidiaphragm. This is called a pneumoperitoneum, and it suggests now that you've got air escaping out of the bowel. If we look at acute peritonitis, we can see here that peritonitis is essentially inflammation of the peritoneum. And the peritoneum is really just a silk-like membrane that lines the inner abdominal wall and covers the organs within the abdomen. Now, there are two types of peritonitis. One is spontaneous and one is secondary. Now, spontaneous bacterial peritonitis, this typically develops as a complication of liver disease or kidney disease. With secondary peritonitis, this can result from perforation of the abdomen, which could be related to surgery or even having peritoneal dialysis, as indicated by the diagram. So, what are some of the risks associated that can cause acute peritonitis? As we mentioned, peritoneal dialysis, which is a medical procedure. Damage to the colon via things like colonoscopies or endoscopies and surgery. Or it can be a ruptured appendix, appendicitis, a gastric ulcer, inflammatory bowel diseases, such as Crohn's disease, and even related to lupus. You can have a perforated colon, cirrhosis of the liver, pancreatitis, diverticulitis, and any form of trauma. What are some of the clinical manifestations of all abdominal disorders? In particular here, acute peritonitis, but this can be related to other abdominal issues as well. Abdominal pain or tenderness, a feeling of bloating, gas, fever, nausea, vomiting, no appetite, anorexia, diarrhea, oliguria, thirst, inability to pass the stool or gas, fatigue, confusion. If you've got peritoneal dialysis, then the peritoneal dialysis fluid can be cloudy and offensive. How do you assess acute peritonitis? Well, blood tests can be done, such as a CBC to determine the white blood cell count, or even here, a blood culture. Imaging tests like abdominal X-ray, ultrasound, CT scan, MRI, PET scan, or analysing the peritoneal dialysis fluid in a culture. Now, the treatment is variable, depends on the cause. However, treatment can be antibiotics, surgery, analgesia, fluids, even a blood transfusion. It depends on the cause. When we look at an acute peptic ulcer, well, all ulcers are essentially open sores. Now, a peptic ulcer is an open sore that develops on the inside lining of the stomach and on the upper portion of the small intestine, the duodenum. Common causes of peptic ulcers are an infection with the bacterium Helicobacter pylori, or it could be as a result of being on non-steroidal anti-inflammatory medications for a long period of time. However, the most common symptom of a peptic ulcer is going to be abdominal pain. What are some of the causes, risks or manifestations related to an acute peptic ulcer? Well, as we mentioned, you've got your Helicobacter pylori bacteria, and they inhabit the mucus layer that covers and protects the stomach and the small intestine. And typically it doesn't cause any problems, but it could. Or, as we mentioned, non-steroidal anti-inflammatory medications that can cause inflammation and aggravate the stomach lining and that of the duodenum. Smoking and alcohol can be associated with it as well. What are some of the manifestations, the signs and symptoms? Burning, stomach pain, nausea, vomiting, hematemesis, melena, dyspnea, syncope, unexplained weight loss, appetite changes. How do you assess it? Well, again, there are lab tests that can be done to determine whether you have Helicobacter pylori bacteria. An endoscopy can also identify H. pylori. Other tests that can be done, like a barium swallow for the upper digestive system, or you can be put onto antibiotics. Common ones would be amoxicillin and metronidazole. Or you could be put onto proton pump inhibitors such as esomeprazole, or histamine 2 blockers such as cimetidine, or even things like antacids, sucralfate, and sometimes, rarely, surgery, which could be endoscopic or it could be open, depending on how bad the ulcer is. Now let's look at acute appendicitis. Now, appendicitis is an inflammation of the appendix. And appendicitis can cause right lower quadrant abdominal pain. And as the inflammation worsens, the appendicitis pain typically increases and eventually spreads and becomes more severe. Typically, it might occur between the ages of 10 and 30 years of age, and the standard treatment may be surgical removal of the appendix, called an appendectomy. What are some of the causes and clinical manifestations of acute appendicitis? Well, appendicitis occurs when the appendix becomes blocked, and this may be caused as a result of a virus, bacteria, or parasites, or commonly trapped by a hard stool called a fecalith, or tumours at the junction of the cecum and the appendix. And what typically happens is there's sudden periumbilical pain that often shifts to the right lower quadrant of the abdomen. And as the pain is there, of course it's going to be made worse by movement, things like coughing, walking, jarring. It may be associated with nausea and vomiting, a loss of appetite, a low-grade fever, chills, constipation or diarrhea, and abdominal bloating and flatulence. When we come to assessment and management of acute appendicitis, as previously, history and physical assessment are always important. However, there are lab investigations that can be done to determine whether there's an increase in your white blood cell count, infection, inflammation. There can be other markers that could be things like your ESR, your erythrosedimentation rate, and again, your hemoglobin, which could indicate possibly that it may be related to bleeding. Things like urinalysis can be done to eliminate a urinary tract infection or a kidney stone, which may cause hematuria, or an elevation in your leukocyte count in your urine. Other tests that can be done can be your imaging, like abdominal X-ray, ultrasound, CT scan, MRI. You've got other physical examination investigations, things like determining whether it could be the appendix, and there's a point called McBurney's point. As seen in the diagram, McBurney's point is now an area between the anterior superior iliac spine and the umbilicus. And in the middle of it is the point. So if you were to press down on this point here, it would demonstrate pain. Here's another example, Rovsing's sign. And Rovsing's sign is now where you press in the left lower quadrant, and as a consequence of the pressure, this will cause right lower quadrant abdominal pain if it's appendicitis. Rovsing's sign. As far as treatment goes, if it is appendicitis, typically an appendectomy will be performed. Removal of the appendix. Another cause of acute abdominal pain could be pancreatitis. Now, with acute pancreatitis, this occurs suddenly, and this can be life-threatening. And most commonly, it's linked to alcoholism and gallstones. But there are instances where it is also identified as idiopathic, where the cause isn't known, which could be related to possibly autoimmune disorders. Some of the causes, etiology, pathophysiology, of acute pancreatitis includes alcoholism, abuse, gallstones related to hypercholesterolemia, certain medications, elevated fat levels such as hypertriglyceridemia, hypercalcemia, hyperparathyroidism, cancers, abdominal injury, which can be related to any form of trauma or even surgery, any infection, and sometimes conditions such as cystic fibrosis. What are some of the clinical manifestations? Well, they may become jaundiced. They will have epigastric pain that can radiate to the back, to the shoulder. They can have left upper quadrant abdominal pain. Prior to that, they may just have abdominal tenderness, fever, tachycardia, respiratory distress because of the pain, and possibly even nausea and vomiting. How do we assess it? History and physical assessment. And typically the pain is in the left upper quadrant. Blood tests, as previously, can be revealed with things like anemia, elevated white cell count, maybe liver enzymes can be elevated, indicating that it's associated with liver disorders. Renal, blood urea nitrogen is elevated, indicating that it's affecting the kidneys as well. And you can have an increase in serum amylase, which is a pancreatic enzyme. Other things that can be done diagnostically are imaging, things like imaging of the gallbladder, the pancreas, the bile ducts, and this can be an abdominal x-ray, abdominal ultrasound, CT, MRI, or even an endoscopic ultrasound. Treatment is typically associated with pain management and possibly, depending on the cause, surgical intervention. If it's related to the gallbladder, then possibly a cholecystectomy. If it's related to the pancreas, then possibly they may have to have debridement as a surgical intervention. Another condition that can cause abdominal pain is an abdominal aortic aneurysm. And this is essentially, as you can see in the diagram, an enlarged area in the lower part of the descending aorta. And remember that the aorta is the largest blood vessel in the body, so if it ruptures, this can be a life-threatening situation. It will be a life-threatening situation. Now, depending on the aneurysm and how fast it increases in size will affect the treatment and varies from careful medical observation to emergency vascular surgery. If it ruptures, it's life-threatening. What are some of the causes, the risk factors, and the clinical manifestations? Well, the causes typically are going to be related to atherosclerosis, which results in arteriosclerosis. And hypertension is the most common cause of the pathophysiology related to abdominal aortic aneurysm. Inflammatory diseases, sometimes infections, absolutely trauma, which can be any motor vehicle accident. Risks associated with developing are going to be cigarette smoking. And probably it's the strongest risk factor for the creation of aortic aneurysms. Age can be a factor. Being a male can be a factor. Being white can be a factor. Family history. And maybe having a history of other types of aneurysms. What are some of the clinical manifestations? Well, some of the clinical manifestations will be deep, constant abdominal pain, which can radiate to the back, the shoulders. And on physical assessment, you may actually see a visible umbilical pulsation, which can be palpated. So assessment and treatment is related to, again, history and physical assessment. Imaging, we said, abdominal ultrasound, CT scan, MRI. And the medical management can be just observation, compliance with medications such as things like antihypertensives, or eventually it could involve repair, which can be endovascular repair, as indicated by the diagrams, or it can be open abdominal surgery. Okay, let's review. Can you name the 4 quadrants when assessing the abdomen? The 4 quadrants are the right upper quadrant, the right lower quadrant, the left upper quadrant, and the left lower quadrant. Can you name the 9 regions when assessing the abdomen? The 9 regions are the right hypochondriac region, the left hypochondriac region, the epigastric region, the umbilical region, the right lumbar and the left lumbar region, the right iliac region, the left iliac region, and the hypogastric region. The 9 regions. Which abdominal quadrant would hepatic pain be referred to? Which quadrant? Well, the liver is located in the right upper quadrant, so it could be referred to that area. Or you could say the right hypochondriac region. What do you understand by the term acute abdomen? Well, acute is sudden. And in the definition, this is now a condition where you get intense pain, which can be due to inflammation, perforation, obstruction, injury to your abdominal organs, and it's typically an emergency procedure. Okay, thanks everybody. If you found this to be of any benefit to you, check out other Dr. Manny Learn shops, recommend them to your colleagues and friends, and subscribe if you think they're beneficial. Take care. God bless.